the hospitals not only control the physicians and the physicians' employees, but they also control the political process. And what I found is that the hospitals, through the hospital associations and through their direct lobbying, will spend hundreds of thousands of dollars with the lobbying process, controlling the legislators, controlling the races, the political races, and how these things occur. And believe me, it is hundreds of thousands of dollars, because I have looked. And I have also seen where legislation has been entered in such a way that nobody can find out where it was entered and who did it. And some of the legislators that I know have told me that yes, this piece of legislation, which has benefited the hospitals, was entered in through the governor's budget, and the hospital's fingerprints are all over it, but you can't find it. You can't prove anything. And that's the extent to which they control the legislative process. What happens to legislators that are already there? Well, one hospital that I looked at, and as I was looking through the Forms 990, I discovered that the U.S. Congressman's wife, who ran her own private company, which was a marketing company, was benefited by a direct transfer of a 7-figure sum to this marketing company that she was running. And that was the current U.S. Congressman. And some might say, well, she did a benefit with marketing to the hospital. Well, I would say, what is a nonprofit hospital doing with needing to market anyway? The nonprofit hospital should be doing things that benefit the physicians and the patients in the community. But the nonprofit hospitals can't stand the existence of the for-profit hospitals. And so what happens when the non-profit hospitals, which are generally faith-based, come up against a for-profit hospital that is going to be run more efficiently and better? Well, they get very upset about it. They can't stand the competition. So at this point, I'm going to turn the rest of the session over to the former mayor of Loma Linda, the city of Loma Linda, who happens to be my younger brother, who now is a vice president for Morgan Stanley, and he and his wife both run frozen yogurt stores in Southern California. Welcome, Bob Christman, for me.
What I'm going to talk to you about today is what it was like to deal with a for-profit hospital that was trying to move into the city of Loma Linda. Now, I won't make any pretense of trying to say I'm going to keep everything anonymous, because that's almost impossible. If I was mayor of Loma Linda, I was obviously dealing with Loma Linda University Medical Center and Loma Linda University. So that is who I'm talking about, and the coalition that they put together. I was mayor for 6 years for Loma Linda, and on the council for 14 additional years, total of a 20-year span. So I was intimately involved with how things worked. And I know most of you practice medicine, and as my brother said, I deal on the finance side. I would much rather see red ink on financial statements than to see somebody's red blood. But what happened is that a group of physicians decided that they wanted to build a for-profit hospital in Loma Linda. And they decided it would be a 28-bed hospital called California Heart and Surgical Hospital. And just to explain the process just a little bit, when somebody wants to put together a for-profit venture in any kind of entity, especially in California, what they had to do was first go to the California agency called OSHPD and get all of their approvals there. And that's a fairly lengthy process, because they tend to make the construction plans and architectural drawings more difficult for hospitals, especially since they're very concerned about earthquake standards anyway. Then in our city, we have what's called the Historical Society that somehow wants to be involved in everything, and we just kind of smile and let them go. And so they first went to the Historic Society, and they determined that they needed to have some pictures of Indians on the wall and some vases in the lobby. And that's when you say, oh, come on, guys, do we really need that? But they smile and say, oh, yes, I think that's a good idea. Let's do it. So then it went to the Planning Commission, and the Planning Commission looked at the plans and determined that it was a valid plan and fit in the current plans for the city of Loma Linda. Now let me explain something. We have several hospitals in and around Loma Linda. It's a fairly major medical community, as you all know. We have what's called the Loma Linda University Medical Center, which has somewhere around 650, 700 beds. Across the street, they have the medical faculty offices, where approximately 600 physicians also have a medical practice that is primarily a feeder to the medical center. Then they have what's called the Loma Linda Community Hospital, which is now owned by Loma Linda University. Then there is in Redlands, just barely across the line, which is a neighboring community, a behavior medical center, basically for psychiatric reasons and drug addiction and things like that. And then about 2 miles to the south, there's Redlands Community Hospital. So you have a lot of medical entities right there together. And this California Heart and Surgery Hospital was going to be a 28-bed hospital. And it was going to be right in the middle of all of those current institutions. And when the Planning Commission for Loma Linda decided it was okay to proceed, that's when it got everybody's attention. And it was appealed to the city council itself. And the appeal was, this is a for-profit hospital, they're going to cherry pick our very best patients. Well, I'm sorry, that's what competition's all about. It's not my job to preclude competition. And they said, well, we need you to stop the hospital process. And I said, okay, politicians want something to hang their hat on. Unless you come to how Washington operates today, you need something to justify your decisions. I don't think they justify decisions today. So we said, what would be the basis for turning down a 28-bed hospital, for-profit hospital, in the middle of another bunch of hospitals in a commercially zoned corridor on a major road in the city of Loma Linda? They said, well, we need you to do a spot zoning change. And I said, wait a minute, a spot zoning change wouldn't be fair. It just wouldn't be adequate. And so I looked it up nonetheless, and I said, well, if you do a spot zoning change, it's because something terrible is going to happen. Like you're going to have a wild animal park and you're going to have tigers that might get loose in the community, or somebody wants to put a tire shredding plant there, and the tire shredding plant would produce toxic fumes or have a fire of some kind, or maybe it's a casino right next door to a church or something like that. But I couldn't find a good justification. So then they said, well, how about a moratorium on any new building? Now, as most of you maybe in life have had to deal with the legal process. The worst thing about the legal process sometimes isn't the legal bills, which can be difficult, it's the delays that it produces. So they wanted a moratorium on any new construction for any new buildings while we determined the validity of the application. And I said, please help me understand the validity for this. Well, let me back up for a second and tell you that I have had a career on the business side of medicine. For 5 years, I was the manager for the Loma Linda Radiology Group, so I was kind of one of them already, although that's a few years back. So I understand, well, let me put it this way, I don't understand them, but I know about RVS codes and CPT codes and DRG codes and all of the billing processes that go with it. Nobody fully understands it, including the people that develop it, just for the record. Somebody agrees with that. So we had our first hearing to determine if we were going to let this hospital proceed. Now, to tell you a little bit about the political process and the finances for a city of Loma Linda, it's 47% of the land values in our city were tax exempt already. So when somebody wants to bring a tax-paying businesses into town, we start getting excited. Most cities can't operate with a 10 to 15% nonprofit ratio in the city. Loma Linda at 47%, we always were looking for car dealerships, for-profit this, for-profit that, anything that would pay taxes. So we had a hearing, and at that first hearing, we had the chairman of the board for Loma Linda University, the vice chairman of the board, which both were from Washington, D.C. We had the president of the university, the chancellor, the president of the medical center, and just for the record, the university and medical center are two separate legal entities, but basically run by the same parties. And I was a little surprised because we also had the president of St. Bernardine's Hospital, which is in San Bernardino, Redlands Community Hospital, Arrowhead Regional Medical Center, which for the record is the county-run county hospital called Arrowhead Regional Medical Center. We also had the president of a for-profit hospital in Riverside, which is 10 or 15 miles away. I was surprised. I said, boy, this is quite a big group here. But not only that, we had a large number of medical center and university employees outside of the council chambers waving signs saying, health care before profits. Okay. I don't know exactly what that was supposed to mean, but nonetheless, the hearings went from 5:30 in the afternoon till 2:30 the next morning. We were exhausted. Exhausted not from digging ditches, but just sitting there listening to the arguments as to why this hospital shouldn't proceed. Now, one of my good friends who was former mayor used to say, when a council meeting goes past 9:30, the good angels go home back to heaven, and only the bad angels are left. So never make a decision past 9:30 at night. Well, we were 2:30 in the morning, and we finally said, why don't we delay this item for 2 weeks and have everybody present on paper some additional arguments, and then we'll decide how we're going to proceed. Here's where it got interesting. During the next 2 weeks, the Loma Linda University spent $1.5 million on a public relations campaign that, to me, still shocks me, and this was 6 years ago. What they did is they hired a major PR firm. They placed full-page ads in the newspaper. They placed TV ads out there begging the Loma Linda City Council to not allow somebody to come in and make a profit off of patients, as if that's not what they do. But they call it excess earnings instead of profits. So then the next thing you know, we got a letter from our congressman, and he indicated that we should be very cautious about how we considered this decision. It was very neutrally worded, but you could tell which way it was going. They went to the county government, San Bernardino County, and the county 5 supervisors passed a unanimous vote suggesting that we should not proceed with this project because it might not be in the best interest of the community. They went to neighboring city councils, including the city of Redlands, and got them to pass a resolution saying, don't proceed with this project, it will impact patient care. And then I was baffled. I mean, this seemed to be critical to them. They had to win this. So I said, let's look at the issues a little bit. Now, admittedly, we're going back 6 years. I haven't kept track of the law, but on June 8 of 2006, Congress let lapse a law that reimbursed medical centers that were profitable versus nonprofits at different rates. Now, why they ever had that law in the first place defies logic for me. I don't know why it matters whether the guy fixing my leg makes a profit or works for a nonprofit or a for-profit. In any case, Congress at that time let that law lapse. and there was no difference in the reimbursement rates. However, even if there was, I didn't think the city of Loma Linda had anything to do about it. It wasn't a decision that came before us, and I thought that HMOs, heaven help them, private insurance companies, Medicare in California, Medi-Cal or Medicaid elsewhere, they're the ones that determine the reimbursement rates, not the city of Loma Linda. So that was something that was beyond the scope of our authority or our decision-making process. So I said, that matter isn't something before us. Then I said, how many hospitals or how many beds are impacted by the addition of 28 additional beds in this community? Well, I counted up all of the hospitals represented that were in this coalition, and it was a coalition of Help Save Our Hospitals or something like that. I don't remember the exact name of it. 4,000 beds. And I said, wait a minute, 4,000 beds represented here, and they're afraid of a 28-bed hospital? And it's almost like the elephant being afraid of the mouse. Although I'm afraid of mice, but elephants aren't. What gives here? Then I said, do any of these hospitals have any expansion plans? Well, as a matter of fact, they did. They had applications before OSPOD, which is the California agency, for an additional 250 beds. And I said, well, who's protesting those particular applications? Well, come to find out, nobody was protesting. So I said, I'm lost here. They're worried about 28 beds. They've got 250 or thereabouts beds planned for themselves. I still need a good reason, a good argument, something to hang my hat on to turn them down. And so they said, well, here it is. They're going to cherry pick our best patients. They're going to take the orthopedics cases or the cardiac surgeries, and they're going to leave us with the pediatric cases or the emergency room cases, because they're not going to have an emergency room. Oh, we got an issue here. No emergency room. I said, well, again, that's not my decision to make. If OSPOD at the state level determines that a hospital can be built without an emergency room in California, I'm not going to get involved with that particular decision. So then they said, well, the competition is going to hurt us. And I better look at my time here. I've got 10 minutes to go, so I better start talking faster. So the competition is going to hurt us. Well, about that time, my father, who is now gone, and my mother, who is here with us, she's 94. If everybody lived as long as she did, you guys would be out of business. We went to Sacramento on a trip, and he had Parkinson's at the time, and I helped him go to the restroom, and his urine was blood red. And I said, how long has it been this way? And my mother said, about a week. I can't get an appointment. So I said, well, that's okay. I've got some clout in Loma Linda. I'm on the council. I used to work there. I know people in the reception offices and in the appointments offices. I'll get an appointment next week. So I called up and said, we need to see the urinary specialist. And the appointment gal said, well, is he a patient? I said, oh yes, he's been there, he's had a procedure done. She went and checked, said it's been 4 years and 2 months, and our cutoff is 4 years, he's no longer a patient here. And so we can't see him for 4 months. And I said, no, you don't understand, this is an emergency. His urine is blood red. She said, I'm sorry, if it's an emergency, take him to the emergency room. We can't see him for 4 months. Well, just a few weeks later, they're trying to tell me that they can't handle competition. They couldn't handle what they had before them. I don't know why they were so afraid of additional help coming in to meet the demand. So that particular argument for me kind of fell on deaf ears. So as it came down, I called the chairman of the board for Loma Linda University and the vice chair, and we had a conference call They were back in Washington, D.C. And I said, look, here's the issues before us. We are being pressured to make a decision to stop a project by changing the zoning or putting a moratorium on any new construction, and I'm having a hard time justifying it. I don't know how you expect us to do that. The answer was, and this amazed me, well, we knew within 10 minutes you didn't have a choice. And I'm thinking, if we didn't have a choice, and the chair and the vice chair knew that, why were they allowing this entire coalition to go forward? Now, here's what else they did. Every hospital in that community set up a table manned by their employees to have people register their opposition to this new hospital. You couldn't get into the hospital without walking around the tables. So at the next meeting, 2 weeks later, they presented us with 13,000 petitions signed by patients, 4,000 of which were allegedly Loma Linda residents, I never counted, and showing us how the community didn't want this 28-bed hospital. I will tell you, us politicians think a little differently sometimes. It's hard to go against a general population mandate. 4,000 residents in Loma Linda, where there's only about 8,000 voters. Let me think. If they really meant that, that means I'm going to lose the next election. That does cross your mind, but you have to think a little farther than that. We have representative government in this country where you have to look at the issues, you have to study the issues. You don't have direct popular votes for a lot of the issues like this. In addition to that, I got a call from one of the senior vice presidents at the medical center. Said, if you do this, if you let this hospital go forward, we're going to do a recall against you. Now, that doesn't sound quite as bad, but it's kind of like jury tampering. You can't threaten somebody prior to a vote. And I told them that. But it got very nasty, got very ugly. And at the night where we had the hearing, second time around, they had 1,200 employees show up with placards. Now, Loma Linda isn't that big a city. 25,000 nighttime population, 75,000 daytime population, because everybody comes in to work at the medical center or to go to school, or we have a large veterans hospital there. So 1,11 to 1,200 people was what the sheriff's office counted. We actually got nervous. We asked for extra sheriff protection because all it takes is one idiot to throw a rock to start something bad. And a lot of them had been told in very specific terms, if this hospital goes forward, you will lose your job because the competition is going to kill us. And I was thinking, wait a minute, aren't you good enough to handle a little bit of competition? Why are you so worried about it? Nonetheless, we made the decision last night, and it was a unanimous vote to let the hospital go forward. Thank you. That's the first applause I've ever gotten for that decision. Now, what happened after that? And I'll look at my watch again. I've got 5 minutes to go, and I was supposed to ask if there were any questions at the end. At the next election, and by the way, Loma Linda is a unique community, so we had only three council members that voted on this because the others were disqualified because they were employees, so there was a conflict of interest. So there was three of us. The next election, they got one of them out. The next election after that, 2 years later, I was gone. And what bothered me was that the senior vice president called all the department heads in and said, I can't tell you how to vote. and you can't tell your employees how to vote, but we need a friendly city council. You didn't have to pass third grade to figure out what that meant. And then at the very last election, the university president actually said, I need volunteers from the faculty to run for council because we need a friendly city council. In other words, allowing a 28-bed hospital meant we were an unfriendly city council. So right now, 4 out of the 5 council members are Loma Linda University employees, and the other has relatives that work there. So basically, they own the city, and they probably learned their lesson. They won't ever let somebody like myself back on there, because I quit working there about 25 years ago. So I wasn't directly connected at that time. So the hospital went forward, and here's really what got interesting, and I see the sign that says 5 minutes, so I'll talk even faster here. They bought the hospital before it ever opened its doors. But they bought the hospital after they played some tricks that I still am shocked about. Now, as my brother said, I work at Morgan Stanley as a financial advisor. And one day, one of my clients came in chuckling with a fair amount of additional earnings. And I said, well, you look like a happy man this morning. He says, well, I'm a real estate broker, as you know. I just sold a piece of property around this new hospital for 3 times its appraisal. I said, 3 times appraisal? He said, well, not only that, there's a restriction on that land now that it can never be used for any medical office building of any kind. So they landlocked that new hospital. Then the physicians that were still working on that 28-bed hospital decided that they wanted to buy some additional medical equipment. And they went to their bank, Bank of America, and here I am going to name names, and said, we want to borrow some money, and they had good relationships. Well, the next thing you know, Loma Linda University knew all about the expansion plans and the use of Bank of America, and that banker should have been shot, and then they should have had a trial for breaking his fiduciary responsibilities to a client. But nonetheless, he divulged to Loma Linda University, who was a major client of Bank of America, what the expansion plans and borrowings were going to be. And wouldn't you know that the financing got a little more difficult. So they got kind of pushed in one direction, and they had the land bought up around them to where they couldn't expand someday if they wanted to. And they finally decided, well, we'll just sell out, because by that time, Loma Linda wanted to buy them out pretty badly. So right now, there is no for-profit hospital in the city of Loma Linda. I don't think there will be one in the near future, because the entire council is owned by the university or medical center or both. And yours truly is still a little shocked 6 years later at the tactics used by nonprofit, and in this case, religiously affiliated institutions to stop competition. My brother and I and my other brothers, we grew up in South America. We were missionaries' kids. And we always grew up with the idea that there was so many needs out there. Our job was to try to fill the needs. In this case, it seemed like their job was to preclude the needs from being filled, because they, in my opinion, put profits before the patients, just like they were accusing the other side. So that's my experience, I am cured of politics, so I'm what's called a recovering politician anyway. So anyway, I've enjoyed speaking to you, and if you have any questions, or if you want to call me let me give you my phone number if you're trying to plan a project like this, and I'd be happy to talk to you about it. I see a hand over here.
Was this a physician-owned for-profit hospital?
Yes, it was going to be, yes. It was about 36 physicians that were going to own this 28-bed hospital. And let me just answer one other question before you ask it. Only 3 of those physicians were on staff at Loma Linda University Medical Center anyway. So it's not that they were going to lose staff to this new hospital, which was one of the other concerns they had. We're going to lose our physicians to this new hospital. That just wasn't going to be the case. Okay?
I don't have a question. I have a comment. Kent, thanks for this. This is incredible. And what you described is exactly what happens to multiple facilities all over the United States. It's the same story in Oklahoma City that we have seen 4 times, except we've beaten them. But it's been a bloodbath. But what an incredible story. Thanks for making the trip.
You bet. Happy to do so. Let me give you my phone number. If you want to call me and just pick my brain on it a little bit more. Obviously, I couldn't cover everything. It's area code 909-213-1040. Now, if you can't remember the 1040 part, it means that you're not working for a for-profit hospital. 909-213-1040. Any other questions?
Right here.
Yeah.
Yeah. For the past going on 10 years, I've had a charity clinic within a few miles of my local nonprofit hospital. And we have several other hospitals around. It was intriguing that over the past 10 years, despite the fact that the hospital actually removed my privileges because I refused to get continuing medical recertification, excuse me. I do have continuing medical education credits. But they refused, and they told me, even though I had the votes to bring it before the executive committee, they refused to bring it up. They wanted me gone. And in the 10 years, they've been referring their sick, the poor, the indigent, the psychiatric patients without any help. They specifically said, go to Zarephath Health Center. But they will never give me an aspirin, an attaboy, and now they threw me off the staff without due process. That to me tells me something. Now, we are now in the process of passing this law for charity, and I've had to walk around the hospital lobby. It's been very, very difficult. But I would like your input on how to deal with hospitals when they refuse and they dump their charity patients on a charity institution that they do not support whatsoever.
Well, it's difficult because, first of all, follow the money. Even if it's nonprofit, follow the money. They get, in California, they get a higher percentage of reimbursement even from Medi-Cal if they have a higher percentage of Medi-Cal patients. And I don't know if you're in California or not.
No. New Jersey.
Okay. So you have that particular issue to look at. Other than that, I don't have any fast answers for you because they have control because they've got the money. And if they can do what they tried to do with us, the spot zoning changes or the moratoriums, or in this case also for the surgical hospital, there were going to be some people from the cardiology department on staff there, and they backed out very quickly. So they also have some degree of control by using the staff privileges issue, which you've just alluded to here. So if they can control that, they can control everything. So So we can talk later if you'd like. Give me a call, but I don't have any fast answers for you.
I think we really have to be careful about how we denigrate profit, how we denigrate creating wealth, which is what profit really is. And it's not the fact of profit itself or wealth creation itself, but it's the way that they're using the government to get an unfair advantage and actually not use the free market, free competition in order to achieve that increase of wealth. It's robbery, it's not profit making.
Okay, let me take just an extra second to add to that. What I felt they were doing in Loma Linda was trying to force the government to abuse its authority. And I just told them, I says, I can't abuse the process. I can't change the zoning that's been there for 20 years. I can't do a moratorium when we have never used that authority before. This isn't Russia where we have arbitrary powers of government that can benefit somebody and help somebody else. I just can't go that route. And of course, that's what angered them so much. And when it came election time, we were all toast. None of the council members that voted on that particular action are still on the council. They got us all out. They sent people door to door. They had meetings inside the medical center. They told us, and as a matter of fact, in the newspaper, for the employees, I think they call it communique, right after this, they put in there, they said, we will wait till the next election to see how the citizens feel about the current council. If that wasn't a threat, I don't know what is. But if you do plan to do a project like this, make sure that the political process isn't filled with people that need higher office, because if they need higher office, they're not going to make decisions based on this kind of process. They're going to make decisions that are going to solidify future votes. And I'm proud to say I don't feel we did that. So anyway, thank you folks, I've enjoyed it.